Government hopes to find long-lasting solutions to the country's struggling health sector as it gears towards implementing the national health insurance. This came out at the second Presidential Health Summit underway in Johannesburg. For more on this, we're joined by Dr Yogan Pillay, the newly appointed country director for South Africa Bill and Melinda Gates Foundation. He's also the former Deputy Director General for the National Department of Health. A very good afternoon to you, Dr Pillay. Thank you for your time here on the SABC.
Good afternoon, and thanks for inviting me to join the show.
Dr. Pillay, we're just trying to understand, in lieu of where South Africa is, given the socio-economic dynamics, why the summit is important, perhaps also what's emerging with the progress in terms of timelines regarding the national health insurance.
So we've had quite a few presentations this morning, and we are now breaking up into permissions to talk about, what are the challenges, what progress has been made, and what needs to be done going forward. And on the national health insurance, we were told by the Deputy Minister of Health this morning that this bill is likely to go to Parliament sometime after June this year. And as you know, there's a parliamentary process that's already underway to scrutinize the bill across all political parties so that there's agreement on the bill sometime this year. The bill, obviously, after being passed by Parliament, will have to go to the President to be assented into law. So that's the trajectory that we heard this morning on the NHI bill. But of course, one of the things that's fairly clear is that even as the bill is being processed in Parliament, we need to ensure that the health system is strengthened. And this summit is really looking at what progress has been made, what achievements have been achieved, but more what problems continue to persist, what are those challenges that we need to get around, and how we're going to do it. So focusing on the how within a time frame of between now and 2025-26 would be critical because, fairly clearly, the country can't continue to wait for the provision of quality health services.
Yep, absolutely, Dr. Pillay. Perhaps you could then speak to us about the current state of healthcare in South Africa as we await these timelines, perhaps especially in regards to, how government is going to be moving forward with the implementation of the NHI, given the gaps that you've alluded to.
So I think the first thing to say is, on the achievements, maternal mortality ratios are down, so fewer women are dying in childbirth. Fewer children under 5 are dying. So, there's been improvements on the mortalities. There are over 5 million people who are currently on antiretrovirals, people who are HIV positive. The numbers of people with TB are coming down steadily, but there are still big challenges. We've got about 2 million people who are not on antiretrovirals, but who are estimated to have HIV, for example. We still have, about 1,000 women dying in childbirth. So, so there are still massive challenges that need to be confronted. The NHI really focuses on two things. One is trying to pool the public and public health spend that's currently being spent in these two different sectors that really don't talk to each other. And secondly, tries to figure out how to get both public providers and private health providers to jointly pool their resources so that individuals who are funded through the NHI fund can access services in either the public or the private sectors. And it's really to improve the quality of care, but more importantly, improve access to services by decreasing the inequities we currently have between the current public sector and the current private sector. Because as I think many people have said before, the current spending in the private sector is significantly more per person relative to the public sector. And of course, for equity and to improve access to every South African, we need to decrease the distance between these two sectors and unify the health sector in South Africa. That's really the challenge confronting the implementation of the NHI once the bill is passed.
No, you speak about equity, inclusivity and equality. I just want to look at it from a practitioner's point of view. What will happen to healthcare providers during the implementation of NHI? Perhaps also how will the supply of healthcare services match or be increased to cater to the demand currently in South Africa? How do you think we're also going to manage those dynamics?
So, it's fairly clear that the current public sector takes care of 80% of the population of the country, and the current private sector takes care of 20%. So the idea is to make access equitable by bringing the public and the private sectors together in one unified, stronger health system, which is neither public or private, funded through an NHI fund. So all of the money that's currently being spent in the health sector will be pooled. And the idea is that through doing pooling, you will get increased efficiencies, both in terms of providing services that are currently not provided in the public sector, but also in terms of, for those patients currently receiving care in the private sector, that the cost of receiving care in the private sector will come down because the private sector will be able to also procure products, drugs, medicines, diagnostic services, which are pooled, which means that we will really benefit from economies of scale. That's a general idea.
Dr. Pillay, I know that there's so many more questions and answers at this point as we figure out the gaps, but also look at the strides that have been taken. I want to thank you for your time at the SABC at this point, just on the back of the second Presidential Health Summit, which you understand is currently underway in Johannesburg. Dr. Yogan Pillay, Deputy Director General for the National Department of Health, or rather he was the former Deputy Director, weighing in on some of the outcomes to date, expectations, and perhaps the strides that have been taken.